To our COVID-19 coverage now, with Ontario into step 3 of the reopening process, there's been plenty of attention placed on falling infection rates across the province. But at the same time, the number of people rolling up their sleeves to get vaccinated has also been tumbling. Well, let's take a quick look at those numbers. Health officials are confirming 127 new coronavirus cases today, along with 2 deaths. This marks a 12th straight day that Ontario has been below the 200 mark. 132,000 vaccines were administered yesterday, which is the lowest count for a Monday since the end of May. 80% of adults have received at least 1 dose, while nearly 64% are fully vaccinated. And that translates to 10 million Ontarians that have had at least 1 shot in the arm. It may sound good, but it's still a far cry from where we need to be with the school year just around the corner. Right now, vaccine intake is lagging among teens.
My concern going into the school year is to look at the youngest eligible group, the 12 to 17-year-olds.
There's no doubt that COVID cases will rise when kids are back in class, and we're all spending more time inside. As it pushes on to get needles into as many arms as possible, the vaccination rate appears to be dropping off. At one point this summer, more than 200,000 people a day were getting the shot. That's down by at least 70,000. And there seems to be a lag in a critical age group, with less than 30% of 12 to 17-year-olds fully vaccinated. Dr. Omar Khan tells me controlling transmission within schools is imperative.
You have all teachers and all 12 and up in one school vaccinated. It's really protecting the younger kids in a way.
All these things then help the under 12-year-olds the most because they are not vaccinated. And we have to be very realistic. They will likely get infected. Hopefully things will continue the same where they don't get as sick, but they can still transmit. And if that's happening, if they're transmitting to someone who's vaccinated, that can help break the cycle of transmission.
We need to build a wall of immunity around every community in Ontario.
About 2.5 million eligible Ontarians remain unvaccinated, and Ontario's top doctor says right now time is of the essence.
You need that 6 weeks to build immunity. You need your first injection, wait 28 days, get your second injection, and then your immunity builds around 2 weeks after that. So if you look at the timing, if you get immunized now, starting, you'll be protected for when we anticipate a rise in cases in September.
According to Public Health Ontario, more than 34,000 cases and more than 10,000 hospitalizations and deaths have been prevented because of vaccines. But Dr. Omar Khan warns we must remain vigilant.
We won't be able to fully reopen the economy until we hit, I think, 75% fully vaccinated in Ontario. Do you see us hitting that threshold?
So unfortunately, things are really tied to our global outlook. And with global cases now starting to climb again, this can mean a new variant happens. Really, it's like before where our opening metrics were based on Alpha and then Delta came. So I think this is what people should really be aware of.
Well, right now only Pfizer is approved for children between the ages of 12 and 17, but that could soon change. The Moderna vaccine is now being reviewed by Health Canada for that particular age group.